This moment in 1903 brings together two influential figures, Niels Finsen and Frank Betts, each representing a different but connected path in therapeutic innovation. Finsen was awarded the Nobel Prize for Medicine for his pioneering work using ultraviolet light to treat lupus vulgaris, a form of tuberculosis. His therapy was non invasive, non surgical, and deeply symbolic. Light as healing, both literally and spiritually. At the time, many saw light therapy not only as a medical breakthrough, but as a divine intervention, echoing religious imagery of purification and revelation. Meanwhile, Frank Betts was busy expanding his medical manufacturing operations, building a large scale factory to support therapy device production, including machines for light, heat, and electrotherapy. His model followed industrial logic, scalability, mail order access, and practitioner education, but with a distinctly ethical mission to empower general doctors to bring modern healing to everyday practice. Together, Finson and Betts embodied a shift. Care was becoming technological, ethical, and accessible. Factories were not just making tools, they were producing hope, hygiene, and healing, grounded in science but charged with moral significance. These developments also laid groundwork for clinical engineering, tools that required calibration, systems that demanded oversight, and technologies that only fulfilled their promise when trusted stewards like engineers stood behind them. To understand the significance of medical innovations in 1903, we have to consider the remarkable pace of change in the broader world. That year, the Wright brothers achieved the first powered flight, launching not just an airplane, but an era of technological imagination. At the same time, Henry Ford founded the Ford Motor Company, setting the stage for mass production, automation, and the industrial reshaping of everyday life. Together, these events signaled the dawn of an industrial age marked by speed, innovation, and systemization. Everything from transportation to manufacturing to communication was being transformed by machines, and medicine was no exception. This was also a moment for rising optimism. People believed science could conquer disease, light could cure infection, and technology could expand not just productivity, but also human potential. That's why this year is so important in our story. Frank Betts' factory, with its catalog of electrotherapeutic and light based treatments, and Niels Finsen's Nobel Prize for UV light therapy weren't just medical events. They were cultural expressions of a new belief that healing could be built, standardized, and even scaled. Clinical engineering would later inherit this very mindset. Engineers became the modern stewards of this industrial vision, making sure that systems of care could be trusted, replicated, and improved within the ethical bounds of medicine. In 1903, the Nobel Prize in Physiology for Medicine was awarded for the very first time, and the recipient was Niels Ryberg Finsen, a Danish physician recognized for his light based treatment of lupus vulgaris, a disfiguring skin disease caused by tuberculosis. This award was groundbreaking not just for the recognition it gave to Finsen, but for what it symbolized about the future of medicine. His work validated the use of non invasive, energy based therapies, showing that care could come not only through cutting or medication, but through light itself. Finsen's treatment involved exposing infected areas of skin to focused ultraviolet light, reducing infection and inflammation. At a time when most medical interventions were still surgical or pharmaceutical, this technique seemed almost miraculous, and to many, even spiritual. The idea of light as a healing force resonated deeply in both scientific and religious imaginations. This moment opened the door to new kinds of therapies, ones that required precision instruments, controlled environments, and maintenance protocols. In short, it helped set the stage for the emergence of what we now think as clinical technology. Today, clinical engineers help realize the promise of pioneers like Finson. They maintain the tools that deliver non invasive therapies, ensure accurate radiation dosing, and manage the infrastructure that allows light, energy, and sound to be used safely in healing. In this way, Finson's legacy lives on, not just in dermatology, but in every engineered act of healing that relies on trust in a machine. In 1903, while the world was celebrating Vincent's Nobel Prize for light therapy, Frank S. Betts was building something equally visionary, a factory for healing. Betts constructed a massive manufacturing facility in Chicago dedicated to producing non invasive therapy devices. These included equipment for electrotherapy, light therapy, and heat based treatments, all designed to treat pain, improve circulation, and stimulate healing without surgery or drugs. But Betts didn't stop at building machines. He also built an ecosystem of education. His company published instruction manuals and trained general physicians across the country to use these technologies responsibly and effectively. This wasn't just a business, it was a mission to democratize therapeutic innovation. And it worked. Through mail order catalogs, Betts distributed therapy devices across the US, bringing modern healing tools into small towns, private practices, and even home settings. This factory became one of the first examples of what we might now call a clinical engineering supply chain, linking device design, manufacturing, training, and patient into one seamless operation. Today, clinical engineers carry forward this legacy. They manage calibration, safety integration of therapeutic systems, and like Betts, they ensure that healing isn't just possible, it's precise, ethical, and widely accessible. Betts' factory was more than a building, it was a model of how technology, training, and trust could transform medicine into a scalable system based on science and care. At the turn of the 20th century, light wasn't just a scientific phenomenon, it was a symbol of hope, morality, and divine intervention. So, when therapies like Finson's UV treatment emerged, they carried more than medical weight, they carried spiritual meaning. Light therapy was described in moral language. It was pure, cleansing, even redemptive. For many patients and providers, this wasn't just technology. It was a gift of grace, something that aligned with deeply held Christian beliefs about healing. Church affiliated hospitals and religious leaders supported these kinds of non invasive treatments, seeing them as more aligned with ethical care and the sanctity of the body. It was easier to bless a treatment that didn't cut, didn't scar, and didn't violate the image of God believed to reside within the human form. The use of light in healing was also directly tied to Christian imagery, Jesus as the light of the world, or healing miracles occurring through touch and presence. So when machines delivered light to treat disease, it felt like a continuation of that sacred pattern. This intertwining of moral belief and medical progress made it easier for new technologies to gain public trust. And that trust was essential, not only for patient acceptance, but for the development of a profession that could ethically manage such tools. Today's clinical engineers still operate in this moral frame, even if they don't use religious language. When they calibrate imaging devices or manage radiation systems, they're doing more than mechanical work. They're helping ensure that the tools designed to heal do no harm. It's a modern form of moral stewardship, rooted in both spiritual tradition and technical precision. Let's close by reflecting on what 1903 represents in the broader history of clinical engineering. It was a year where industrial speed and therapeutic spirit merged. Betts's factory, Vincent's Nobel Prize, and the rise of non invasive healing technologies showed us that machines could do more than build. They could heal, and importantly, they could do it without incisions or trauma, using energy, precision, and light itself. This marked a turning point in medicine, where devices didn't just support surgery, but became therapeutic agents on their own. Clinical engineers today stand in direct line with that legacy. Whether managing UV devices, laser systems, or thermal therapies, they are continuing a tradition of care through energy based, non invasive, and ethically guided technology. In short, 1903 wasn't just about innovation, it was about showing what technology, when managed with care and purpose, could reflect not only scientific progress, but a moral and spiritual mission of healing.